Okay, let's talk about something incredibly important: strokes. When someone has one, every single second counts. What you do in those first few moments can literally be the difference between life, death, and long-term recovery. So today, we're going to break down exactly how to spot the signs and what to do. Let's get right into it.
All right, before we dive in, just a really important heads up. All the information we're covering today comes straight from the UK's National Health Service. Think of this as an educational guide, but it is absolutely not a substitute for professional medical advice. If you have any health concerns, please always talk to a healthcare professional.
So what is a stroke, really? Well, the best way to think about it is like a brain attack. You know how a heart attack happens when blood flow to the heart is blocked? A stroke is the same idea, but for the brain. The blood supply gets cut off, starving brain cells of oxygen. And that makes it a very serious, life-threatening emergency. So here's what we're going to cover. First and most importantly, we'll learn how to spot the signs using the FAST test. Then we'll get into why every second is so critical. We'll also look at what the road to recovery can look like, and finally, what we can all do to help reduce our risk in the first place.
Okay, this next part, this is probably the most critical skill we're going to talk about today. Knowing how to recognize a stroke immediately isn't just a piece of trivia. It's knowledge that could genuinely save someone's life. It's all about seeing the signs and acting without a second of hesitation.
And you know, thankfully, there's a really simple and powerful way to remember the main symptoms. It's an acronym that spells a word that tells you exactly what to do. FAST. Honestly, this is something that everyone, and I mean everyone, should know by heart.
Okay, let's walk through this FAST test, step by step. F is for face. Ask the person to smile. Look closely. Is one side of their face drooping? A is for arms. Ask them to raise both arms. Can they do it, or does one arm drift down? S is for speech. Ask them a simple question or to repeat a sentence. Is their speech slurred? Are they struggling to find words? And the most important letter, T. T is for time. If you see even one of these signs, it's time to call 999 immediately.
Now, FAST covers the big, obvious signs, but you've got to be aware of a few others too. Things like a sudden weakness or numbness that just appears on one side of the body, or sudden vision problems, like blurred vision or even a complete loss of sight. It could also show up as confusion, or a sudden, really severe headache that comes out of nowhere. And sometimes it's just sudden dizziness or a fall. The key word for all of these is sudden.
Okay, this is a super important point. What if the symptoms just go away? One minute their face is drooping, and the next they seem fine. You can't just ignore that. It could be something called a TIA, or a mini-stroke. And you should treat a mini-stroke as a massive warning flare that a full, major stroke could be right around the corner. It's still an emergency. So let's make this absolutely crystal clear. The T in FAST stands for time. Time to call 999, period. Don't wait. Don't wonder if you're overreacting. And please, this is crucial, do not try to drive them to the hospital yourself. Paramedics can start treatment right there on the spot, and they know which hospitals have specialist stroke units. They'll get them there faster and safer than you ever could.
So, you keep hearing me say every second counts. But why? What's actually going on inside the brain that makes it so urgent? Let's take a quick look.
It really comes down to this. There are two main ways a stroke can happen, and the treatment for each is completely different. The most common type is an ischemic stroke. Think of this as a blockage. A blood clot gets stuck and stops the blood flow. The other kind is a hemorrhagic stroke. This one's a bleed, where a blood vessel in the brain bursts. The problem is, just by looking at someone, you have no way of knowing which one it is. And that is exactly why getting someone to a hospital is the only option. The first thing doctors will do is rush them for a brain scan, like a CT or an MRI. This is the only way to see if it's a clot or a bleed. And they have to know, because giving clot-busting drugs to someone with a brain bleed would be, well, catastrophic. So this diagnosis is the absolute first step to saving them. Okay, so after that intense emergency phase is over, the focus then shifts to the road to recovery. And this part of the journey is really different for everyone, but it's a path that's supported by a whole team of dedicated specialists. And this is where acting fast really pays off. When a patient gets to the hospital quickly, it unlocks a whole menu of powerful treatments. For a clot, they might use powerful medicines to dissolve it, or even a procedure to go in and physically pull the clot out. For a bleed, the focus is on stopping it and relieving the pressure on the brain. All of these options are on the table if you get there in time.
Yeah, recovery is definitely a marathon, not a sprint, and it's different for every single person.
The rehabilitation plan is tailored to them. It might involve a ton of physiotherapy to help with movement, speech therapy, and even cognitive rehab to help with things like memory and thinking. It's this whole comprehensive approach that helps survivors get back as much of their life as possible.
All right, let's wrap up by talking about something we can all be proactive about: prevention. Because while you can't control everything, there are absolutely things you can do to take control of your health and seriously lower your risk of a stroke.
So there are several medical conditions that are, major red flags for stroke risk. The big ones you'll hear about are high blood pressure, diabetes, and high cholesterol. Another one is an irregular heartbeat called atrial fibrillation. The good news? All of these are manageable. Working with your doctor, you can get these under control.
And that brings us to the stuff that's really in our hands, the clear, actionable steps we can all take. Things like quitting smoking, eating a healthy, balanced diet, getting regular exercise, and cutting back on alcohol. And just as crucial, if a doctor prescribes you medicine for something like high blood pressure, you've got to take it. It's that simple. So look, if you only remember one thing from all of this, please let it be this. A stroke is a brain attack. It is a true medical emergency. And learning that simple acronym, FAST, is one of the most powerful things you can do to help someone when they need it most. Acting fast saves lives.
And that really leaves us with one final thought, one final question for you. You've got the knowledge now. You know the signs, you know what to do. The question is, are you ready to act?